Yeah, Lord and Brian, it's a very concerning issue, and the numbers just seem to keep rising. So for a moment, let's go ahead and put this all into perspective. Now, first, here in Lubbock, there's 191 confirmed cases of coronavirus. Today, we've learned over 100 of those cases stem from local nursing homes, and of those 100 cases, at least 60 of them are associated with the Whisperwood Nursing and Rehabilitation Center, where 5 of the 6 coronavirus-related deaths took place. Thankfully, we've had 42 recoveries. Now, also today, the Texas Department of Health and Human Services released a 28-page guidance for nursing homes and long-term care facilities dealing with COVID-19. This guidance first off discusses how facilities should handle patients that have tested positive for the virus. It introduces the SPICE protocol: surveillance, protection, isolation, communication, and evaluation. The document also provides nursing homes with instructions on what to do if an employee contracts a virus, requiring staff who do test positive to not return to work under any circumstance and self-isolate at home for at least 7 days. Of course, you may remember we spoke to a former Whisperwood employee who got infected with COVID-19 and alleges he was still required to come to work even though he believed it wasn't a safe environment. Here's what the city had to say about these new state guidelines.
We have reviewed that guidance, and the guidance that was provided is very similar to what we issued through our quarantine orders and the guidance that we were providing about 2 weeks ago to our nursing homes. That information has been distributed to the nursing homes, and their compliance with that is facilitated by both the health department and Texas Health and Human Services.
Now, if you stay up to date with our website, everythinglubbock.com, our investigative team did a little research on Whisperwood, especially as it concerns some of their most recent violations reported by the Texas Department of Health and Human Services. Just some of those violations include that Whisperwood didn't provide care that keeps the dignity of residents, failed to store, cook, or serve food safely, and failed to conduct CDC background checks for contracted employees in a timely manner. Now, most of these violations were corrected by August 11th of last year. We reached out to Whisperwood about those violations, also asking if they plan on following the state's new guidance. But we haven't heard back just yet, and state officials do tell us they've been working with Whisperwood as it relates to infection control, but their full investigation of Whisperwood, including the 5 deaths, has not yet been completed.